Hi, my name is Richard, and this is my friend Leslie.
Hi.
And we're going to be making a video which will be a personal journal and hopefully some information that might be of use to you as regards to hip replacement or hip resurfacing surgery. When I was about 48, I started having pains in my groin. At the time I was rowing and exercising frequently, and I thought I might have pulled a muscle or a tendon. Went to see a doctor, and at first he couldn't diagnose the problem. Then they took some x-rays and discovered that I had severe osteoarthritis in both of my hips. At 48, I was devastated. I couldn't believe that at that young an age I would have this problem. Not only that, I was told by the doctor that I'd have to have both hips replaced. And in fact, he even gave me the names of people I could talk to about who had just had their hips replaced. However, I decided I didn't want to do that. And all the advice I'd been given from others was avoid surgery until you really can't do anything else. So I started doing a little research and found out that you can take certain supplements and do certain exercises. So I gave up jogging, and then I started taking some supplements. The first one was glucosamine chondroitin, and then after a while I added to that flax oil, and then fish oil. Finally, in the last few months, I've added turmeric and vitamin B12. More on that later. But anyway, so now we have a whole collection, and both Leslie and I got these pill dispensers because we're taking 6 supplements a day to try and keep our bone health healthy. Anyway, a few months ago the symptoms started getting progressively worse. I'd gone reasonably well over the past 12 years, but then I found the pain and in my hips was increasing, and I found myself limping and also stooping over, which hadn't been much of a problem. I also realized that I needed to find the opportunity in terms of my work schedule and other issues to try and make sure I could have the time to set aside for hip surgery. So first thing I needed to do was to do some research. And on the internet, well, I'm sorry, I need to back up one more time. I decided to get another diagnosis. I went to a local doctor and did some new x-rays, and yes, he confirmed that in fact the situation had gotten worse, and yes, indeed, it was time for surgery. He also quoted a cost here in American dollars of approximately $65,000 to $80,000 depending on the procedure. I've been without medical insurance for the past few years, and realized that having it done here was just simply not possible. So I started looking to what they now call medical tourism. It turns out that there are many facilities abroad where you can have all kinds of procedures done. And after some research, discovered the Apollo Hospital in Chennai and Dr. V.J. Bose. Turns out Dr. Bose is one of the leading surgeons in the world for doing hip resurfacing surgery as well as hip replacement, but he really does specialize in the Birmingham hip replacement surgery. Dr. Bose also was educated and trained in London and also worked with the inventor in Birmingham, learning how to install these prostheses. I think that's how you say that. Anyway, you know what I mean, these implants, right. One thing I did discover, and that is the resurfacing is, in my opinion, the solution I was looking for, because it removed the least amount of bone, which means that perhaps if something went wrong or you needed to do them again in the future, you'd have more, then you could go ahead and do the total hip replacement. But I would prefer to do the resurfacing, and another reason was the range of motion apparently was a little better, and also it's the favored method by many athletes, and I hope that I can continue with my exercising, rowing, cycling and so forth, which I haven't been able to do as much recently. So those were the things. And then lastly, the most important part is that age is a big factor in whether or not you can have the resurfacing. It turns out they generally do not install the BHR in patients over age 60. However, fortunately, thanks to perhaps exercising over many years, my bones are in good enough condition that Dr. Bowe said, yes, I'd be a good candidate for resurfacing.